Okay, back to school time. It means focusing on the classroom, but for a lot of students, there is something that they want to pay attention to. It's really more for the parents. There's an alarming national shortage of Adderall, which is a commonly used prescription drug to treat ADHD. We've all heard of it. According to the FDA, logistical challenges and worker shortages may be contributing to this problem. A survey from the National Community of Pharmacists is finding more than 6 in 10 pharmacies are reporting difficulties obtaining Adderall medication for patients. Joining us to discuss the shortage is addiction medicine specialist Dr. James Besante. Always good to see you, doctor. You know, first of all, they're saying that this is because of staffing, but like a lot of things, there have been supply chain issues. Is that the case with this particular drug?
Well, first, thank you for having me. And absolutely, drug shortages, particularly generic drug shortages, are not a new phenomenon, but a common and increasing issue in the United States of America, where approximately 90% of filled prescriptions are generic drugs. Drug shortages are thought to be the result of a combination of factors, as you mentioned, supply chain issues, natural disasters, regulatory hurdles. And given the low profitability of producing generic drugs, manufacturers routinely decide to stop production. And one company halting production can dramatically impact already fragile supply chains.
Adderall helps patients with ADHD to actually focus. According to the CDC, we have a couple of statistics here. 10% of children aged 3 to 17 have the disorder. So if you can't get access to this medication, what would be an alternative?
Well, there are several different alternative medications to treat these disorders, especially in children, some of which are not stimulants. So it's important to note there are very effective alternatives to Adderall. However, we've seen supply chain shortages of critically important medications like antibiotics, antivirals, where alternatives are less available. So, talk to your pediatrician, talk to your psychopharmacologist, your psychiatrist, your PCP. There's several different alternatives to treat ADHD, but the larger issue here about shortages of generic manufactured drugs can impact drugs where there aren't alternatives like Adderall.
And Adderall is one of the most commonly abused drugs, too. When you think about college students and what they can get their hands on, how do you speak to this problem?
It's a great question. The nation has seen a rise in stimulant use and overdoses involving a combination of opioids and stimulants. However, this rise has largely been attributed to illicitly manufactured methamphetamines, not diverted prescription drugs like Adderall. So while stimulants are an increasing issue here in the United States of America, this issue has not been driven by the diversion of prescribed stimulant medications.
It's so good to get your perspective on this. Is there any other drug shortage that we should be aware of? Anything coming down the pipeline?
Well, the FDA monitors this closely. And as a physician in practice, one of the reasons this doesn't stand out to me is that every day I'm getting an email from my hospital or pharmacies about shortages of different medications. It's a constantly evolving problem. So supply chain shortages can resolve, production can increase or resume. And so it's a very dynamic issue that's always changing. When this happens with a controlled substance like Adderall, it's very newsworthy, but it's a consistent issue here in the United States of America. And I think it'll continue to be an issue as long as the nation relies so heavily on the production of generic manufactured drugs, which again is in part set to offset the exorbitant amount Americans pay for name brand drugs. Again, Americans pay drug prices 2 to 3 times higher than other developed nations. So when we talk about this issue, part of it has to do just talking about drug pricing in general here in the United States of America and our reliance on generic manufactured meds.
Dr. James Besante, thank you. And people need to be up to date, making sure to do their own research with these drug shortages. Thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.